to everyone, and I welcome you all for today's intriguing session of Rubaroo at SMBT Medical College. Recently, I read a famous quote saying, "Success is a journey and not a destination." True that. The doing is often more important than the outcome. Indeed, success seems to be a movement, but it takes a lot to achieve it, and there is always an exhilarating story behind it. Today, we are going to listen to one such story from our own student from batch 2016, Dr. Vishakha Kurundwade. I feel very proud to acknowledge her achievement in PG entrance exam. She has nailed it by securing All India rank 176 in NEET PG exam 2023. Please give a big round of applause to Dr. Vishakha. Heartiest congratulations, Vishakha. We all are very proud of you, and your achievement has brought a glory of success to the institute as well. She has been a bright, hardworking, and dedicated student all throughout her MBBS. These qualities of her have helped her reach where she is today. I'm sure her journey must be about perseverance, learning, studying, and most of all, sacrifices, right from coming out of her comfort zone, like moving out of her house, to shutting down all her social media accounts. This sounds like a tapasya to me. All these techniques might seem to be cliche, but they are the ultimate facts. And our students, our SMBT IMS&RC students, who are also NEET PG aspirants, are very keen to hear from Dr. Vishakha about her insightful story. So, Ms. Janvi from batch 2019 and Ms. Anushri from batch 2020 will be interviewing her. And this interaction is going to be not just inspiring, but will also exemplify the values like discipline, diligence, and zeal for learning. So without wasting time, let's dive deep into this interview session to learn the secrets of Dr. Vishakha's success. Please welcome Dr. Vishakha.
Hundreds. What was your feeling when you saw the rank? Did the rank sink in?
I think it has not yet synced in. I would say it has been a month since the rank has come out, and I am still enjoying the fact that I'm at this stage right now. But yes, it's a slow process, and I think I'll get back sometime. Yeah, but it's a nice thing. And more than the rank, I would suggest that a feeling of being here is a great opportunity for me. Thank you, SMBT family, for having me here today. Yeah, thank you so much.
Ma'am, when we talk about a rank, which is a 3-digit rank, 176, it is insane for me to be speaking about the rank to you right now. But when we talk about it with such ease, it takes a lot of effort and everything that you have to give in to achieve this rank. So how did you go about it?
See, the first thing is the problem with many of us is we don't aim that high. Somewhere we have that barrier in our mentally that we can't achieve it. The fact that I'm one of you people and sitting here is a realization for you guys that you can also do it. It's not something unachievable or undoable or something like that. Anybody can do it. It's not only meant for government colleges or something like that, because we have that mental barrier that we are from a private college, so we won't go that far. Something like this. We limit ourselves only. So you just should have that, you should drop that mental barrier from your state that let's see, at least let's give it a try, then we'll see what happens. When I started preparing, I was not aiming for AIR 1 or something like that. Many people who know me know that I'm a very realist person. I know, of course, AIR 1 is I'm not going to be AIR 1, but I know I want to have a decent rank, a decent mark, from which I would get a branch of my choice, college of my choice. So that was my only goal, that I should get a decent rank. I did not ever aim for some 100 or some any digit of it. I was just aiming to be the best. To give the best as I could.
You indeed are the best now.
Thank you.
You should be after SMBT. Ma'am, you mentioned you wanted a dream branch, dream college. Have a little insight you're working there.
So when I started preparing in my third year, when I got introduced to the clinical branches as such, so I was very interested in surgical branches. I used to like anatomy a lot in my paraclinical subjects and in pathology for that matter. So when I started doing my third year and fourth year, I got an insight that I like orthopedics as theoretically also, and luckily when I got into my internship, I got a good exposure of that branch and a good mentors also for that matter. So yeah, so gradually over a time, I decided that that should be my dream branch. And for the college, let's see what college I get and everything like that. But yeah, I want to go for the best out there is. Yeah.
That's really great, ma'am. As everyone says, discipline plays an important role in the long-term success. So can you enlighten us about how discipline can help students for competitive exams?
Yeah, so discipline actually it is not just for the competitive exam. I would say you have to make it a lifestyle. So when I started preparing, even for my universities during my even everybody knows here. I think even teachers know that I used to study with my study partner Ojas. So we used to have a very definite timetable. We used to plan everything, every day, every subject, every topic, what we have to complete in one day. If we did not complete it, how would we manage that remaining part in the next day, or when would we manage that? So you have to wire your brain that way over some years, so that at the end of when I took a drop, it was not hard for me to have that discipline, because I had did the same thing for the past 3 or 4 years during my universities as well. Like whenever I have an exam, I plan that exam for 3 or 4 months before the exam. Not even there are tentative dates or something like that. Uske pehle I used to plan everything, every subject, how many days I'm going to give that subject and everything. So I had every day planned, and I used to also consider during my planning the buffer days, as we call it, because we don't feel like studying every day. You have to consider your off days, you have to consider birthdays and everything. We have parties, we have everything. So you have to consider your social life as well. And if you plan everything, you have that liberty of doing what you want. And also you have that, you don't have anxiety at the last moment. You don't have that burden of what I'm going to do and how I'm going to do it at the last moment. So that was a very good part. And also exactly, so when you plan everything, it is not hard to achieve what you want. And you can be accountable to yourself that way.
Ma'am, but when you're planning everything for the team and when you are keeping accountability to yourself, there are days when you're just not motivated to even get out of your bed, or you want to start your plan. So how do you actually keep yourself motivated to this journey?
Yeah, so as I told you, I used to make a daily target, a monthly target, and if I'm not feeling it, I used to just not study. I used to, it's like a neither or scenario. If you're not feeling like it, just don't do it. Don't do anything half-heartedly. Don't go out and watch movies half-heartedly feeling guilty that you're not studying, and don't do it otherwise also. You want to study but you can't study, and then you're just wasting your time. You're not even enjoying, you're not even studying. So it's better to take that day off, plan your day कि नहीं मुझे आज नहीं करना है तो ठीक है आज का I'll just manage it somehow in the later part ऐसे. But you have, if you're not feeling it, just don't do it at that time, I would suggest, and do something productive or otherwise. Do something of the entertainment, or go out and play, or have some sport activity, or work out for that matter. I used to work out a lot when I was preparing because I did not have any other activity as such. When you don't feel like doing it, just get out of that whole zone and then come fresh and start again.
As the exam patterns have been changing,
Yeah.
we as students need to start preparing since the beginning. So what steps did you take in your early years of MBBS which helped you in the long run?
When you start in your first year, I would say first year and fourth year are very chaotic years. Like in the first year, you have no idea where you are and what you're doing. And fourth year also is the same somehow, because you are introduced to the vast subjects like medicine and surgery and OBGY. You don't have any idea where you're going and what you're doing. So I would suggest second and third year are very golden years, where you have lots of time. You have small subjects. You can complete those subjects also, and you can start preparing for your PG from that period. That is not an excuse to not study for universities. I was even my partner also, we both were having distinctions in first year, second year, third year and fourth year subjects, all subjects. So so we had that, we completed our basic subjects university wise. And if you know, NEET and universities have this in common, that they focus on previous year questions a lot. So at least even if you try to complete those subjects from both the sides, like from NEET point of view also, from the MCQs point of view also, and from the university's point of view also, even if you manage to complete the previous year questions of that year in that year itself, it is very easy in long term, because you have completed at least 80% of the whole topic. So it becomes easier when it's not something like when I started preparing, I don't know what is the topic. I just have to revise it because I did it in my universities anyway. So that was easy for me that way.
Well, actually, great to hear, ma'am. I hope all of us could follow this. Ma'am, we have our interns batch right now who will be given it across the few months.
Yes, next
coming
month.
forward. So if you had to give them some advice and they want to learn from you the mistake that you made, how would you want them to approach it?
During internship, I understand it is very hard to crack your NEET in first attempt, but you can score as maximum as you can by managing very smartly. It's not something, if you will decide कि I'll read medicine in my medicine posting, it's not going to be possible. You have to be smart कि in your shorter postings, in your psychiatry posting, in your radiology posting, when you have time in your hands, you have to use them for your big subjects. When you have less time in your hand, you have to use them for smaller subjects. Sometimes you're not going to have time at all. You will be all burned out from work, from not like studying and everything, but you have to have that key. You have to have some smaller targets, as I told you before, and then you have to manage your time very prioritizing your subjects. Also during internship, fourth year mein, if you have prepared very nicely your clinical subjects are your strength. Clinical subjects in NEET especially have a very high weightage, like 20 questions from medicine, 20 questions from OBGYN, surgery, everything. So if you complete those subjects in the final year itself, or at least theoretical also you know them better, you don't have to read those subjects again in your internship. At least not the marrow notes or whatever notes you're referring to from any class for that matter. You don't have to sit and read those whole notes because you already read them just a year before. You don't have to prepare for those. You have to focus on the paraclinicals, which you don't actually like specially go and read for your preparing for your NEET. If you see, even if the weightage of medicine, surgery, OBGYN is high, if you just go and solve one GT today, you will get half of the questions right without studying, because they are very basic questions. Everybody knows them. So the edge you get is from anatomy, physiology, biochemistry, because nobody does them. So you have to do something nobody does to get that edge over the others. So when you have time in your internship, just focus on the paraclinicals first. It makes your base very clear. And then even if you don't get time, you can just go through the MCQs for the major subjects and you get covered, because the explanations are very vast. So even if you don't have time to read the theory as such, your explanations also make up for it, and you can just cover the subject accordingly. So I think internship mein you can work accordingly ki don't focus on the main subjects, just focus on the other subjects first, and then go for the main subjects ki MCQs or something like a shorter version, and then you can cover it very nicely.
That's very nice advice to utilize our time in the best way possible. Ma'am, like you mentioned earlier, previous year questions helps in university examinations as well as for some preparation for the NEET examination. So, but there must be some difference between preparing for NEET and preparing for a university. So, could you shed some light on it?
See, I would say cracking both of the exams are very easy. It's not about cracking. It's about in universities, it's enough to crack the exam. You're passed. There is nothing more to do. But if you want to have that edge over the others, if you want to have that extra mile, if you want to go that extra mile, you have to work that way. There is a famous saying that if you don't sweat in your practice, you will bleed in your war. So you have to, it will be very rigorous, but you have to do it anyway. And if you see university point of view, I would say ki, everybody is used to learning and making up for two pages ke answers and everything. But in NEET, it's a plus point that way ki the answer is right in front of you. Even if you know 20% of that topic, you can at least try to guess the answer. University is not that way. You have to know the whole answer. Otherwise, you can't attempt that question in itself. But NEET has the higher point in that way ki, even if you have the slightest idea of that subject, even if you have other points other from that subject, you can at least try to attempt that question. And you have that, even if you practice that question for 3 or 4 times, the 5th time, even if you don't know the topic at all, you still can attempt it. So that is a very good point. And as I said, previous year questions apply for both the universities as well as NEET. But again, universities के लिए previous year question करके, you get 60%, 70% of the portion is done over there, and then you can have that extra whatever you have time left and in that. But in NEET, what happens is if you do only previous year question, it's not going to work. It's like a shortcut. So it's a first step, because you have to understand, as I said before, previous year question to everybody is going to do. It's not something rocket science that nobody does it and then I'm going to do it. SNA, everybody is going to do it. So what are you going to do other than previous year questions? That is what matters. So you do previous year questions first, just finish it's a basic necessity. So you have to complete that first, and then you have to go to the other things which are actually necessary, like going for the extra revisions, going for the here and there and everything like that. So in universities, previous year questions might be just enough just to get to the exam, but in NEET, it's just a first step. I would say.
Ma'am, right now, like you were talking to us, you mentioned about revision.
Yeah.
You had initially mentioned about, I wouldn't like to name any site, but you mentioned on various platforms
Yeah.
which people use for learning. So when you're doing that, what did you do? Did you make your own notes? How do you go about these revisions? How did you face them?
Okay. So, yeah. So what happened is I have a very habit of making notes of myself, but it was not possible for me to make my own notes during my preparation phase because it took a lot of time and efforts, and somehow I tried them but I could not do it nicely. But then there are shorter versions, like I did my first read nicely from any source for that matter. Doesn't matter which source you're using, just do the first read nicely. I did my first read nicely, and then I took a shorter version of the same every platform has a shorter version of the same notes. I use that for my second read, and then whatever topics I felt ki they are not given in the shorter version, I just added those points in that shorter version. And also I used to give a test every week, one test every week. That was my goal. So that was my disciplined timetable wala thing. So I used to give one test every week, and if I found ki this question was not there in my notes, I didn't know only this answer, then I used to just make a point of referring that question in my notes itself, and used to like concise everything in my second notes. And I did not like make notes as such. I just annotated the notes I had from before, and I just concised every material that I was using in one source as such. So it helped me in my revisions as well.
Thank you so much, ma'am. Talking to you right now has already been shedding so much light on all of us. I'm
Thank
sure
you.
students have some of these skills and use them for our preparation. Ma'am, getting a little personal, if you allow me to do so. You invested another year after your internship to give the entrance again. So what was the thought process behind putting another year of struggle?
Actually, unfortunately, I could not crack. I could not get a good rank in my first attempt. I had a decent rank, but I knew I could do more. I knew I had it in me, and I can always put my time and efforts. 24/7, doing that the same thing is different from doing it from in your internship. And a branch of my choice and college of my choice, I was not getting that. So I was like, yes, why not? The 1 year in long term doesn't even count. So yeah, so I decided to go for it. And yeah, my parents believed in me. Like they're like, okay, fine, you want to do it, then just go for it. Yeah. So, but yeah, it's a difficult decision to make. It takes a lot of will, because I had also invested a year for my MBBS preparation as well. So I have the idea of what it takes. I have to do the same thing all over again for a year. It is very taxing. It is very mentally, it takes a toll on your mental health also. So I would in fact suggest ki don't go for the rank. Rank is, yes, I understand that 176 rank is a huge deal and everything. But if I had gotten a good rank in my first attempt also, so I would have gone for it. It's not worth investing another year just for a one, even if you're getting your dream branch in your first attempt, just go for it. You don't have to think again just investing just for a good or a better college or a better branch or something like that. I would go, it's not worth it. Wasting 1 year just for that one rank or something like that. But yes, if you think you have not done your 100%, if you think you have not given your 100%, you can do it, and you feel that you have it in you and you can still do it, then go for it.
Like you said, taking a drop here takes a toll on you. It has some effects on your physical or mental health. So, did you face any such issues? I'm not trying to be into like how to face such issues.
So everybody knows that being in medical school comes with anxiety and overthinking. So it's not some surprise or anything. But yeah, I also had anxiety problems and everything. But see, you have to be very realistic. These things are going to happen. You are going to face problems. This is just an exam. I would also suggest, it is very a different approach to this, but I would also suggest having a person to talk to who is out of all this, like a non-medical person or a friend who is not doing all this. Because it is like seeing your whole thing from a window from outside, and then you realize how small of a thing it is. It's just an exam. It's nothing else. It's just one exam. It's not a do or die question. the anxiety and the overthinking makes you feel like you won't do anything if you don't crack the exam in itself, but it's not like that. You have to make yourself, you don't have to be overwhelmed by this. And as I said, yeah, I had anxiety problems, but what I did was I maintained a good sleep schedule. I had a 8 hours sleep compulsory. I used to do that. I'm an early riser, so I used to sleep at 10 o'clock itself. I used to wake at 5 o'clock. I used to have like good 7-8 hours ka sleep. And I had, as I told you, I worked out. I had I maintained a good diet. I did not eat junk food and everything, because somewhere when you get lethargic, you go into lethargic and overthinking and everything. So it is very hard for you. But if you maintain a good nutrition, good sleep, half of your anxiety goes there. And when you plan your things, your anxiety turns into your confidence. If you know you have done it, there is no need to get afraid. It's as simple as that. And always keep people to talk to you. It's even if I isolated myself, as ma'am said, I did switch off my social media accounts, but there was a reason I did that, because I did not want to get overwhelmed by the society's pressure, because there are too many accounts. If you see, there are too many accounts and channels and everything who promote doing like NEET, and they just have commercialized everything. So they make it a point how to crack NEET in this much days, how to do this, how to do that and everything. I did not want to listen to that. I wanted to do my own thing. So I just switched off everything that came, every negative thought, every positive thought. I did not want to see my non-medico friends enjoying where I'm studying 24/7. So yeah, so I did not want to have any distractions. You have to make it a point, but also at the same time, I had my friends. I'm very grateful that I have my huge friends and friend circle and my family who I daily called. Like I had my 3 or 4 friends. I used to call them daily. I used to make it a point to take a proper break of hour or 2 hour and talk to them about everything but studying. But yeah, exactly. So, and also having proper breaks, as I told you. So that helps in mental health, well-being. I used to make a point of giving GT every Sunday. But after that GT, after that 3 hours of GT, I used to not open a book. I used to just sit, relax, sleep. For that matter, is to watch a movie. I watched too many movies in my preparation phase, because that was the only source of entertainment I allowed myself. It is like a reward system. If you study for the whole week, then you will have that feeling that you have earned this break, and you will able to enjoy it also. And then you can pull off the next week as well. And then the cycle goes on. So,
Ma'am, honestly, sitting here right now, it is just a little shocking to me to listen to an achiever or talk about watching television, watching movies, going out, working out, and yet achieving everything. So it just helps us know that you can follow your hobbies, have strength faster, and not study. I'm not saying you do not, but not study 24/7 continuously and yet achieve what you have. Thank you for sharing light on those aspects as well. Ma'am, one more thing. So when you actually saw your name written and then you saw your India rank, how did it feel? Like every effort that you take in, your family, your friends, your support, how did it all come up to you? How did it come to you?
yeah, it was very overwhelming. I was not even in the town at time of my result. My friends told me my result. I did not even see my result. And then I just saw it again and again. I was wanted to make sure if it is my result really. Yeah, but exactly, it is just overwhelming. The life of your whole 5 years flashes before you, the efforts you have taken, the sacrifices you have made, as I told you, because yes, you have to make sacrifices. It's not a joke to sit for 16 hours straight in your library or whatever you're studying to give yourself that push ki nahi, you have to do it anyway. You have to do it, and you can do it. So yeah, it was a very overwhelming feeling. Even my parents were also very everybody was crying at that point. But that is a feeling you live for, I think. So yeah, so I would again say that it was not the feeling was actually very overwhelming, because I was not aiming for this. I was not thinking about the outcome. I was giving my 100%, and the outcome was what it was going to be. So yeah, that's what.
I'm hearing from you, you are very motivated to put in 100% efforts for any future examination or in general life. Ma'am, how would you describe your journey in SMBT? Like, you stepped away from home, you came to a completely unknown place, and you spent 5 years here. So how would you describe your journey?
The SMBT you look at now was not like this before. When we joined in our first year, it was very different. And I would say that it is a boon and a bane that the city and college are very far away from each other. Like now we have transport to go and come. At that time, Amazon delivery guys also were not allowed to come in the campus. So it was a very different scenario back then. So actually it was a great thing for me because we did not have anything but study. So we did study very nicely in our first, second, third year. And again, the libraries, teachers, I know many teachers personally because I have interacted them on day-to-day basis since my second year, third year, and referred to them not only for my academic doubts, but also my non-academic ones, like Sati ma'am, Gosavi ma'am. Everyone here present here have been texting me, have been talking to me since I was the student, and also after my internship, after my even the results came out, everybody, I was in daily contact with every one of them personally, and they made sure that every person feels at home because even they know what it takes to be here, out of the city, out of your comfort zone, coming here. So yeah, the teachers, the academics, everybody was very supportive. Also, we had a good infrastructure and everything, as you know it. The hospital is also very nice. So yeah, we had a good clinical exposure as well. So that helped us a lot.
Now, before we can go on to our next segment, I had one little question more to ask you. So, when you are preparing for a competitive examination, students these days actually sit in maybe the room or the library and they're in front of their tabs and trying to learn from books, if not online resources. How would you place clinics as important through the process of actually getting a rank in a competitive exam?
See, clinics is like if you don't, you learn by doing. The first thing is, and if you have seen the recent IMS&RC papers or even the AIMS or the NEET papers, if you see, when I attempted the exam in my first attempt itself, I realized I don't remember half of the stuff from my books. I remember because I did them. Like there were simple questions, like there was a green colored IV cannula and they just asked me the number of the IV cannula. Now I don't remember reading that. I remember because I used that cannula in casualty. I remember urine output, what is the basic urine output required. So that these questions, you cannot learn them from books. You have to do them. And sometimes what happens is your basic instincts, your common sense works the best in these scenarios, because if you see, these NEET questions are all clinical questions. They are not something like one word questions or something like that. They are not filling the blanks. They have a patient came in and was this and was that. So if you have that approach, if you have a habit of sitting in the OPD, doing your OPDs nicely and everything, so you imagine a patient coming in, you imagine a patient has this, and it helps you a lot because your wholly approach changes. You don't just look at that disease. You know, अच्छा ये ना मैंने देखा है clinical में ऐसे ही होता है. And basic questions like if you see NEET में surgery के questions, medicine के questions are half clinical based only. So if you have done your postings nicely, you can crack them because it is very easy. The questions are not something high fundu कि वो book से आएंगे. There may be questions. I'm not saying कि 100% questions, but there may be 5 or 6 questions, but the remaining 15-16 questions, you can crack them easily just by doing your basic theory and your clinical postings. The clinical postings help you a lot in, like, there was a question in my NEET PG, from which quadrant do you do your ascitic tapping? So this is not something I remember reading from my books. I remember this because I saw ascitic tapping in my clinical posting. I did that. So I don't have to remember कि हाँ ये मैंने कहाँ पढ़ा था, अरे मुझे पता है क्योंकि मैंने किया है. It's as simple as that. So it helps a lot. And even in IMS&RC also, I would say IMS&RC also has a great clinical questions, and even specifically they focus on trauma questions, which can be easily solved. If you do like a week of casualty, you will be done with all the trauma questions. So yeah, that clinical postings help you a lot, and even not just NEET, in your whole life, I would say, because that is what we are doing it for. It's not something, the rank is just a step. You are going to be a doctor one day. You have to treat patients. My mom was not well during my preparation, and I had to treat at her home. I could not do that just by reading a book. I did that because I attended postings. I knew how to treat dengue because I had seen that. So that is what helps you long term. It's not something you read and just can do it.
Thank you so much. Right now, I am a little short of words because I have spoken to you. Known you as someone who used to sit outside the library when you were in your final year and I was in my first year. To sitting here and actually interviewing you, It is great, ma'am. I am too small to say this to you right now, but we as SMBT are genuinely proud of you.
Thank you so much.
After an SMBT, right? We are so fortunate and glad that we have actually gotten to speak to you. And ma'am, before I could give the audience the opportunity to question, I would request everyone to just give Vishakha ma'am a standing ovation before
Thank you.
we proceed on further. So, ma'am, if you permit, we would like the audience to ask you a few questions.
No problem.
You can pass the mic on, and ma'am would be kind enough to answer questions.
What was your difference in preparation for your first attempt and your drop after your drop year?
So in my first attempt, I knew what subject I was lacking in. What happened was during my first attempt, I was very good at the clinical subjects, that is their major subjects. So during my repeat attempt, I did not focus on those because during my first attempt, I knew कि हाँ मुझे ये आता है तो ये मुझे नहीं करना है. For example, OBGY, medicine, I did not do those subjects in my repeat. I won't suggest anyone to do that unless and until you're very sure. But if you ask me, I did not read medicine, I did not read OBGY, I did not read PSM because those subjects are very strong. And I knew that I was very sure that if I'm strong in those subjects, I won't have to touch them. But I knew my biochemistry, my pharmacology is very weak. So I gave a nice time to those subjects where I'm weak in. I gave my sweet time in my first attempt, in my first read during my attempt. And then I focused on the subject. It's not about a bigger subject and a smaller subject. You have to analyze which subject you're weaker in. That are your major subjects. And the subjects you're stronger in, that or your minor subject. It's not about the size of the subject, about the weakness and strength of the subject you are individually. And yeah, and my attempt, if you see in my repeat attempt, I had a lot of time, of course, rather than my internship first attempt. So of course, I had more time to utilize and more time to give it individually to my each subject. So I had more time to do revisions also. So yeah, I managed them accordingly.
Ma'am, thank you so much for giving us your time and spending the time out to actually come to campus and talk to all of us. It means a lot to us.
Thank you so much. I would like to thank everybody. Thank you, Dean sir. Thank you, Janvi also, Anushri also, because coming here, speaking, talking here and sitting here is also a great opportunity. It's a great feeling to be on this side and not in the audience. And I hope I see many people coming to this side. I would also say it's not just me. My friends also deserve equal appreciation. Many of my friends have scored great marks. My batch has done a very nice this, and I would like to clap for them as well because they have done an outstanding job here.